Okay, so patients come in saying that they've trodden on a thorn or they've got something stuck in their heel, and we're a little bit suspicious that this one might be a corn. So of course we go and remove the callus cap and just have a gently look in there and make sure we can see. And usually if there's been a puncture or a thorn or a prickle or something go in here, you can see a little puncture mark going through the callus, and you can usually see it's a whitened section where there's a little hole going in there. And we can't see that at the moment. So we're just suspicious that this might be a corn, because it's sitting right below that. If you know the anatomy of the calcaneus or the heel bone, there's a lump of bone that sits right in there called the medial calcaneal tubercle. So we can see the corn here, and we'll go and remove that. Now, it's not uncommon, even if there was a prickle in here, to get this sort of callusing around where the prickle or there's a little inclusion cyst or something's gone in there. So we'll go and just gently remove that and see if we can see any signs of a thorn or anything in there. And it's looking like it's just straight up a corn, which is easy to diagnose but hard to fix longer term, particularly when we can see that. And we can actually feel under here, right where my left thumb is there, that the fatty pad's actually quite thin, and you can feel the bone through the skin. So what we're doing now is just cutting around gently, if I can just try and lift that out, gently around the edges, and try and remove as much of that hard skin and corn as we can. And we can now see there's no prickle or thorn or anything in there. And I'll try and grab this for you to show you to the camera. So we've grabbed that corn there now, and I'll just show it to the camera. You can see that it's this really hard, dense, really quite large piece of hardened skin. So I've got that off to the side. Now what we'll do now is go and smooth those edges down, sand it, and get some emollient and try and get the pressure off that area in the patient's shoe to relieve this long term.